Howdy everybody, I want to thank you for joining me on my Poop Tip Tuesday. So today we're going to go all into probiotics. I know this is a topic people have asked me. I get a lot of questions on this. We'll talk about exactly what are probiotics, what do they do, who should take them, and what my thoughts are on probiotics, and we'll answer your questions live on today's Poop Tip Tuesday. Guys, don't forget, let's talk about poop. Hey guys, my name is Dr. Samir Islam. My passion is to give you tips and tricks to help out with your gut health. I grew up in a small town called Odessa, Texas. You may have known that from the movie Friday Night Lights or even the TV show. I did my undergrad at the University of Texas at Austin, go Longhorns, and I did my GI fellowship training at the Mayo Clinic. So guys, let's talk about poop. Alright guys, man, thank you for joining me today. If you're joining for the first time, my name is Dr. Islam, and yes, I am your poop guru, trying to keep you happy and healthy from the top to the bottom so you can live your ultimate life. Every Tuesday, I go live on the social media channels to answer your questions you guys may have about your gut health or health in general. If you haven't already, don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to a weekly newsletter where I can get you great tips and tricks. I'll put a link down below. Also, in this video today, let me know if you're watching this live or on the replay and where you guys are watching this at. I'd love to hear from my audience. And if you put in your questions in the stream, I'll be able to answer them as well. Paul, good seeing you. Thank you for watching. Sue, good seeing you as well. And Paul, I'll get to your question as well. So I have a lot of patients, individuals who come ask me about probiotic questions. Dr. Islam, what probiotics should I take? What are the best probiotics? What are my thoughts on this? And I thought I would just do a live video today on everything you need to know about probiotics. I can answer your most common questions when it comes to that. I can also answer any questions you guys may have on the live stream as well. So let me know in the comments, do you have a question about probiotics? That I can tell you a lot of people ask me this as well. So first off, what are probiotics? So probiotics are essentially live bacteria in a pill that you put, you either swallow them or you ingest them, and the thought is that it's supposed to change or adapt your gut microbiome to give you the healthy bacteria that is there and to hopefully rebalance what is going on. And what we think could be going on for a lot of individuals is that there's an imbalance of your gut microbiome. There's too many bad guys, too many inflammatory bacteria, and too less good guys. And when you have that imbalance, that can cause bloating, distension, gut issues, diarrhea or constipation. And sometimes we can maybe see manifestations with skin issues, joint issues, brain fog, and things like that. So the idea is by giving yourself a probiotic, either in a pill or a food form, you can change that gut microbiome, make it normalize, and get things better. And this is why people take probiotics when it comes to pills. So what exactly are we doing when we take a probiotic? Well, what we're doing is that we're hopefully trying to adapt and change that gut microbiome. Your gut microbiome is such a unique environment for you and your individual person. And it can be different for every single individual, even within the same household, even if you are related. So many factors play a role when it comes to your gut microbiome. Previous use of antibiotics, whether you were delivered cesareanly or vaginal delivery, whether you were breastfed, the types of food that you had in the past, the types of food that you eat now, stress, sleep, whether you live in the United States or elsewhere, what type of foods that you eat, what is the makeup of that foods, the fibrous content of those foods, whether you have foods that are very processed. There's so many factors that play a role when it comes to your gut microbiome, that my gut microbiome is different from your gut microbiome, and it's different from your kids as well. And so what is the evidence? Who should take a probiotic? So I am the type of doctor that's going to give you information that's based on clinical science. And what we know so far is that we don't have a lot of good evidence that probiotics play a significant role in terms of determining your gut health. What we do know is that certain individuals, so for example, if you've had ulcerative colitis, you have what's called a J pouch, which is a pouch you have after a certain surgery, that probiotics tend to help decrease your risk for a condition called pouchitis. We also know that for some IBS patients, or those who have irritable bowel syndrome, probiotics may play a role in changing your gut microbiome to make them feel better as well. We do think that somehow probiotics can play a role sometimes when it comes to fatty liver, when it comes to other conditions as well. What we don't know is exactly what role that plays. And what we don't know is that we don't know exactly how much of a role that'll play when it comes to your long-term health, and whether there's going to be any problems when it comes to your long-term health as well. So we don't have a lot of good science behind that. My best analogy I give to my patients, there's a whole lot of marketing when it comes to probiotics with a sprinkling of some science behind that. So the biggest question is, all right, if we don't have a lot of good information for probiotics, and we don't know exactly which are the, if we don't know exactly what is going to be, what the effect is going to be, what are my thoughts when it comes to taking a probiotic? And here's what I would say. It, like any type of supplement, probiotics are not they're not regulated. And so like any supplement that's out there, we have certain regulatory forces that are out there that allow us to determine if something is going to be the best thing for us or not. And also too, we use these regulatory bodies to help us determine what the long-term side effects are and what the long-term studies are for these particular medications and treatment as well. We don't have these regulatory bodies when it comes to probiotics and other supplements as well. And so having said that, we don't know exactly what are going to be the best probiotics for each individual person. What we also don't know is what is considered the best probiotics. So a lot of people ask me, what do I recommend? What I would say to a lot of my patients, number one, speak to your doctor about whether you should be on a probiotic, because they typically are safe in a lot of individuals, but there are some case reports we have out there of probiotics actually causing a lot of harm to people who actually may be immunosuppressed, who may be on steroids, who are on cancer treatment, and actually you can have a really bad systemic reaction. So number one, like all supplements, speak to your healthcare provider. Number two, I would recommend going to a very reputable, well-named company to try and get your best probiotics. And there are a lot of companies that are out there that are big pharmacy companies that are known to have a good reputation behind them. Johnson & Johnson has great probiotics. We know VSL has a couple of good probiotics, and there are a lot of good probiotic qualities that are out there for companies that would make me feel more comfortable to get a probiotic from that particular company. And there are millions of probiotics that are out there, and some are made by individuals or companies that may not be the best people out there. There are a lot of myths when it comes to probiotics as well. A lot of people ask me, hey, Dr. Islam, does different strains matter? And what I can tell you is that we don't have any evidence right now, whether it's a single strain, multi-strain, or particular strains are going to make a significant difference for the vast majority of people. We know that VSL number 3 is a great strain for individuals who have pouchitis or at risk for developing problems when they have surgery. We also know that lactobacillus and Saccharomyces tend to be the more common probiotic strains that are seen in the vast majority of probiotics, and some of the clinical studies suggest that that may be beneficial as well. But we don't have a lot of good information for that. Nor do we know if the number or the amount of probiotics in a particular pill matters. We don't know if 1 million, 10 million, 100 billion actually makes a difference when it comes to improving your gut health when you take that. And also, we don't know if you have a probiotic that has multiple different strains that are out there, if that's going to make things better for you as well. We just do not know the answer to that. So a lot of these questions people ask me, unfortunately, we don't have a lot of good information. But if I have somebody who comes to see me who says, hey, Dr. Islam, I want to try a probiotic. I understand what the risks are, and I understand that I may not benefit from that. As long as they're not on any type of immunosuppressive medication, and I don't have a reason for them to not be on, I'll say, all right, give it a shot, but know that you may not get any benefit, and know that it may be a waste of time and a waste of money as well. That's kind of my spiel on probiotics. I hope you guys got some good benefit from that. And let's go over to live questions. All right, so Paul, good question. Hey, Dr. Islam, what is the best way to come off of omeprazole? Oh, it's a great question. It is so hard to get off of omeprazole and medications like that, because once you take that, your body gets kind of used to it, and whenever you get off it, you get what's called rebound acidity, which you have worsening acid reflux than before whenever you took the medication. So here are my recommendations. Number one, I would first off with maybe taking it every other day. And the days that you don't take that, you can supplement another medication called an H2 antagonist like Tagamet, or maybe some Tums, or Gaviscon, and do that for a couple of days. If you start to do well, spread it out to once every 3 days and do the exact same thing. Supplement those other days with either maybe an H2 antagonist. Tagament is a great one we use. Use Gaviscon, use some Tums, and then kind of spread that out until eventually you can get yourself off of omeprazole. Now, I will tell you, it may be difficult for some individuals because you may need this because of how bad your acid reflux could be. And so sometimes you may need this on the occasional basis, and that's perfectly fine, not a problem. But I'm with you. If we can get you off of as many medications as we can, that's going to be the best thing I recommend for anybody who has reflux or upper GI symptoms. Great question, Paul. Gracie's good seeing you. Thank you for watching from New York. John's good seeing you. Thank you for watching from Minnesota. Baseline, good seeing you. Yes, omeprazole is a very good medication. It's one of the first line treatments that we use for dyspepsia. Dyspepsia is indigestion or kind of pain in your belly that's not typically heartburn or regurgitation. It's one of the first line treatments, and we know that omeprazole is effective in individuals who do have dyspepsia. All right. Perfect. All right. Sorry, I'm just going through some of the questions here. So Elijah, yes, good questions. What happens if you swallow a tissue? Well, that tissue depends how much it is in there, but that tissue will maybe get stuck inside that esophagus, and then maybe over time it may dissolve. But if it doesn't, we actually may have to take a look with a small little scope, see what's going on. This is actually a common thing that we do, that as GI doctors, things get stuck in the esophagus all the time. I've had to remove food, beef, bones, coins, things like that. And whenever we do that, they call us in. We use a very small camera, and we'll grab that thing, take it out so it doesn't bother you anymore. And you can have that with tissues as well, or any type of substance that you try to swallow that could get stuck inside that esophagus. Good question. All right, Tasia, good question. Hey, Dr. Islam, what is dysbiosis? This is a great question. So dysbiosis, this is a change in your gut microbiome. So we know that normally what we typically want is a good balance between the good guys and the bad guys. We can have more good guys, it's even better. But when you have that imbalance occurring, when you have more bad guys getting increased inside your gut microbiome, you produce more inflammation, you produce more inflammatory markers. That is called dysbiosis, a change in the bad way to your gut microbiome. And there are different ways that we can take care of this. Sometimes probiotics, like I just mentioned before, may be helpful, but more importantly is actually changing your diet to rebalance that gut microbiome, whether it's adding fermented foods, whether it's adding prebiotics, whether it's adding more fiber. That'll help change that dysbiosis, make that balance normal again, so you don't have as much gut issues going on. It's a great question. It's very confusing to a lot of my patients as well. All right. So Baseline, good question. Doctors never prescribe probiotics. Why? Well, that's a very good question. And I would tell you, excuse me, most probiotics are available over the counter. In fact, the vast majority of them are. And number two, we just do not have the science to recommend that for a lot of individuals. We just don't. There are so many studies when it comes to probiotics, and people are trying to see if this does benefit. But their studies are not lacking. But I try to tailor this individually to what I'm treating. And for me, for my practice, if I do recommend a probiotic, I will certainly recommend that to my patients as well, if they need it in the right setting, but not for everyone. Good question. All right. Perfect. All right. All right, so I'm just going through the questions. Good question. So this is a really good question. So do probiotics reduce the effectiveness of antibiotics? They do not. Great question. Now, another great question people ask me is, hey, Dr. Islam, I took some antibiotics. Should I take some probiotics to replenish my gut microbiome? And what I would tell you is that we don't have good evidence that taking probiotics is going to help it out. But let me give you a secret. What's going to work even better is that if you supplement your diet with effective prebiotics and fiber, that's going to give you more of a change for your gut bacteria. Here's the issue when it comes to trying to replenish your gut microbiome with a probiotic. You're trying to take one pill and try to have a dramatic change in each individual's gut microbiome. So you're just adding bacteria inside what's going on here. You're not enhancing the good guys already in there. If you want to enhance the good guys, what you need to do is feed those good guys that's individualized to your individual person. And the best way to do that is to add prebiotic food, have fiber, have a plant-based diet, add fermented foods. That's going to give you the good guys to make them better, as opposed to trying to add in a set of bacteria that may or not be released in the right area where it affects your GI tract. So more importantly than taking probiotics, whenever you have antibiotics, is to improve your gut microbiome by adding prebiotic foods, which will enhance the natural good guys inside your gut. All right. Good question. Hey, Dr. Islam, is a sore stomach due to heartburn and acid reflux? So I will tell you, maybe, sometimes. So usually acid reflux presents as burning or regurgitation. That is the classic definition of acid reflux. And if you have that, I can tell you, all right, off the top of my head, I know you have acid reflux. If you have other symptoms, maybe pain, maybe other issues going on, it's hard for us to know that. Sometimes giving a trial of an acid medication, seeing your response, may be enough for us to diagnose you with acid reflux. Sometimes we may also have to take a look with an upper endoscopy to see what's going on inside your GI tract as well. All right, Tad, it's good seeing you. Thank you again watching on the live channel as well. So Mohammed, good question. How long does it take to heal an ulcer? Well, typically if you have an ulcer, we recommend treatment for 8 weeks. And when I say treatment, sometimes it is acid medications, sometimes it's twice daily acid medications. But if you have an ulcer, typically it takes about 8 weeks or 2 months for it to heal. And if you have an ulcer that we see with the scope, we typically want to confirm that it's been eradicated around 2 month time, around the 8 week time, because that allows us to see what is going on. Now, if the ulcer is still there in 2 months, we need to figure out why. Were you taking the medications? Or do you have other issues why you could be having the ulcer, such as smoking, drinking alcohol, taking non-steroidal anti-inflammatory medications? Do you have an infection like H. pylori? Just something else going on. But typically it takes about 2 months or 8 weeks for an ulcer to completely heal up. Great question. All right. Perfect. So Syed, good question. Nexium 40 milligrams, can it be taken indefinitely? Well, I will tell you, it really just depends on the individual, and I can't really answer this for you individually. My job is to see if we can get you off of medications as much as we can, and if we can treat you naturally. But there's a reason we have medications, and there's some individuals, for any number of different reasons, that should be on an acid medication. Whether you have an ulcer, whether you have a condition called Barrett's esophagus, which is a precancerous lesion of the esophagus, whether you have pain, burning, upset stomach, whether you take anti-inflammatory medications, these are individuals that may need to be on acid medication lifelong. So I would specify you should talk to your doctor about whether you should be on this long term or not. And if you don't need to, we have options that we can do to potentially get you off of this medication. Great question. All right, perfect. So Abdul Razak, good question. Dr. Islam, how often should you have your colon checked? Once every few years or sooner? It's a great question. So number one, we want to get your colon checked starting at the age of 45 years old, unless you have a family history of colon cancer, in which you need to be done sooner. Now, if at 45, your colon is normal and you're doing fine, not having any symptoms, you're good for 10 years. If we find polyps, it may be 5 years, it may be 7 years, it may be 3 years. It depends on the size, how many polyps, and the type of polyps that we remove. Now, in between then, you start to have issues like pain, diarrhea, constipation, bleeding. That may mean something could have popped up or could have occurred, and at that time, you may need to have another colonoscopy sooner. So it depends on a lot of different reasons: family history, what we find, symptoms, and how you are doing as well. But routinely, it's usually once every 10 years for a negative colonoscopy. It's a great question. All right, perfect. All right, guys. So, good question. Abdul Razak, good question. Can a laxative be used for prolonged periods of time, or is it harmful? It's a great question. A lot of people ask me this. So, in general, Laxatives are very, very safe, especially laxatives like Miralax. It's been studied for a long time. It's been studied for years, and there are virtually no long-term side effects with taking a medication like that. It's not a problem whatsoever. Now, I will tell you, if you have new onset constipation, if you have a new change in your bowels, if you're all of a sudden, hey, I'm now constipated, I used to not be like this, this is something that should not be ignored, and it should be checked out. It should be investigated. But as long as you've had it for a long time and you clear it with your doctor, typically there's no long-term consequences with being on a laxative. But once again, always make sure you speak to your healthcare provider for anything. All right, guys. Perfect. All right, guys. I want to thank you for watching today. Don't forget to tune in next Tuesday for my next Poop Tip Tuesday. I'll hopefully have a great topic. Let me know if you have any more questions on probiotics. I think it's a great topic. A lot of people are confused. Comment down below. I'll see if I can answer them. And if you haven't already, don't forget to smash that like button, like, share, and subscribe. And I'll see you guys next week. Thanks, everybody. Take care. Have a great